zero COVID is no longer the goal once you have 70 to 80% of people vaccinated. Whether you start at 30 cases or 800 cases, you can still open up safely.
As contention over Australia's roadmap out of lockdowns ramps up, modelling experts have said opening up with a 70% vaccination rate is still possible even with hundreds of daily cases. In a statement released by the Doherty Institute ahead of new modelling expected to be presented to government this week, a spokesperson noted that COVID won't go away, but it will be easier to control. Once we achieve 70 to 80% vaccination, we will see less transmission of COVID-19 and fewer people with severe illness, and therefore fewer hospitalizations and deaths. Once targets are met, the Doherty Institute states it's important for some public health measures to remain in place to prevent our healthcare system from becoming overrun.
So in terms of the Doherty modelling, what they're saying is around 80%, you have options and choices. Your level of restrictions, what you permit. It may be that we actually have indoor mask wearing for years in certain settings. We may have factors that you're only permitted to go to certain high-risk venues if you're vaccinated.
The scientific body behind Australia's path to COVID normal forecasts that with 70% vaccine coverage and partial public health measures, there'll be 385,983 symptomatic cases and 1,457 deaths over 6 months. With no lockdowns and optimal public health measures such as testing, contact tracing and isolating, this number could be significantly reduced to 2,737 infections and 13 deaths.
But once you start opening your borders, every state's going to see case numbers, and that's why we just have to get used to the fact that our aim during the pandemic is to keep people safe and healthy, keep them out of hospital, but trying to get to a normal life as soon as we can.